There is a Medicaid directive on the books by the previous administration as to regards of RU 486 coming under the Hyde Amendment. Can you give us an assurance that that won't be changed, or are there plans to change that?
Senator, as far as I know, there are no plans. I certainly have had no discussions with anyone about changing that policy, but again, I am not confirmed as Secretary. I haven't had those discussions, and I promise to continue to keep you informed.
All right. Thank you. One of the other concerns you and I talked about was the conscience protections, and the administration has announced plans to revise those and change those. I guess the question that I would have is, can you give us, and you may not be able to do that at this time, but will you give us forewarning on what those changes are going to be? As a pro-life obstetrician, I feel I have a constitutional right to have those protections as I practice medicine. And the idea that the administration may try or attempt to take away a constitutional right that I have by saying what I must and must not do as a practicing physician is rather offensive to me. And what I would like is the assurance that we'll at least get a heads up on what that's going to be prior to a unilateral announcement of that. Can you give us that assurance?
Senator, if confirmed, I would be glad to not only give you that early warning of what the plans are, but I can tell you right now that the President supports and I support a clearly defined conscience clause for providers and institutions. He always has. I always have. It's been in place in Kansas the entire time I've been in elective office. I know there was some concern about the regulation that was proposed or implemented at the very end of the previous administration, that it was overly broad and frankly overly vague. So I don't think from the discussions that I've had there is any intention of interfering with the underlying legal basis that you have just suggested, and I will certainly be glad to keep you informed.
There'll be a significant number of children who are still left out of the healthcare system. I'm looking at a report this morning, which you may have seen, may not have seen. This is a study on late preterm births, a cause for concern. And Senator Lamar Alexander and I wrote premature birth legislation in the previous Congress to put some resources into this general area. And obviously these studies here, average expenditures for premature low birth weight infants were more than 10 times as high as uncomplicated newborns, is one of the studies. And this one here talking about babies born just a few weeks prematurely are more likely to have developmental and behavior problems later on, as well as health issues, than those who arrive closer to their due dates. The study was released on Monday from very respected sources on this subject matter. There's been this notion for years, of course, that children are just small versions of adults, and therefore what most of us grew up with at a time when there were limited pharmaceutical products and so forth for children, it was just dividing aspirins in half and quarters and so forth. And we've learned over the years, as a result of legislation here under the leadership of Senator Kennedy and others, that we need to deal the physiology of children very different than adults, and we need to deal with them accordingly. And I just wonder if you might take some time and talk a little bit about this. I think it's a tremendously important area. I note that I think the deputy now of FDA is going to be a person, as he's been nominated, with a strong background in pediatrics, that area. And so I was particular needs of children, and including providing benefits for maternal care. In light of these studies with premature births, it seems to me ought to be an important part of a health care formulation. And I wonder if you might address that issue.
Certainly, Senator. First of all, I think there's no question you have been one of the nation's leaders on children's issues, on family issues, on making sure that whether it's child care or the Family Medical Leave Act or a whole variety of areas, we keep children as the number one focus. And once again, you've identified a critical cost effectiveness strategy. If we provide and if we identify women early on in their pregnancies and they have adequate and routine prenatal care. The likelihood of delivering a full-term baby at adequate birth weight is significantly different than if a woman has no prenatal care and shows up in the delivery room for a first or second visit. That not only is a huge cost issue, but as you've identified, is a huge quality of life issue. Children born prematurely have all kinds of struggles, health struggles, mental health struggles, long-term health issues, not to mention just the cost of ICU care, which often is borne by Medicaid budgets. So I think that the President understands this challenge very well. Not only, as you suggest, has he nominated a deputy at FDA who is a pediatrician and comes from that background and those sensitivities, but also in his 2010 budget outline, blueprint, there is a proposal for a nurse visiting program, a visit early on in a pregnant mother's care, identifying at-risk moms, trying to follow up on them on a regular basis, getting the kind of care and assistance needed along the way. There is study after study which indicates those are very successful programs, successful in terms of health outcomes and very successful in terms of cost reductions.